If you're over 60 or approaching 65, listen up. This could save you thousands. One small Medicare decision made at the wrong time can lead to ongoing extra costs, potentially thousands of dollars every single month for years. Medicare looks simple from the outside. You turn 65, you get a card, and everything is supposed to fall into place. But underneath that, there are several moving parts. Part A, Part B, Part D, Medicare Advantage, Medigap. And many people mix them up, not because they are careless, but because nobody explains how they connect, leading to silent, costly mistakes. Here is what matters. Not everyone makes these mistakes. Not everyone pays a penalty. Your situation depends on your coverage, your work history, and the choices you make along the way. But there are 5 specific points that every senior approaching or already on Medicare should check, just to be sure their own situation is covered. This video isn't here to scare you. It's here to empower you with something far more useful. A simple 5-point checklist you can walk through today so you're never caught off guard later. Picture someone getting ready to retire at 65. They feel healthy, their finances are in order, and Medicare feels like one more form to deal with eventually. That feeling, I'll get to it, is often the precise moment where costly mistakes begin. Not because the person did anything wrong, but because Medicare timing does not always wait for eventually. If you rely on Medicare, Social Security, or a fixed income, this is worth a few focused minutes. Subscribe to James USA Guide so you can understand these rules clearly before they turn into a monthly cost or a coverage gap. Next, let's look at 3 real situations that show exactly how these mistakes happen, quietly, and often without anyone realizing it until later. Let's look at 3 situations that show how these mistakes actually happen. Not because someone was careless, but because Medicare timing works differently than most people expect. Situation 1, the Part B delay. Picture a 65-year-old who just retired. He feels healthy, so he tells himself, I'll sign up for Part B later, once I actually need it. Months pass, nothing happens right away. Then, when he finally applies, he discovers a late enrollment penalty and, in some cases, a gap where he has no coverage at all. He did not ignore Medicare on purpose. He simply assumed there was no rush. This assumption is precisely the root of the mistake. Situation 2, skipping Part D because I don't take medication. Now, picture a 66-year-old who feels fine and takes no prescriptions. Part D feels unnecessary, so she skips it. A few years later, her doctor prescribes a new medication. When she goes to enroll in Part D, she learns that because she went too long without any drug coverage, a penalty has been added to her monthly premium, one that can stay with her going forward. A constant reminder of a decision she wishes she could change. She was not wrong to feel healthy. She was simply unaware that Part D is not just about today's prescriptions. It is about protecting yourself for the prescriptions you may need later. Situation 3, choosing a plan based on price alone. Think about a retired couple comparing Medicare Advantage plans. One plan has a lower monthly premium, so they choose it right away. Later, they find out their longtime doctor is not in that plan's network, and one procedure requires prior authorization they were not expecting. Medicare Advantage is not the problem here. The problem is choosing a plan without checking the details that matter most to their own care. Do you notice what these 3 situations have in common? In each case, the senior did not make a reckless choice. They made a reasonable assumption based on what felt true at the time. This isn't about blaming anyone, it's about revealing the hidden traps, which is exactly why these mistakes are so common and why this video is so crucial for your peace of mind. Here is something else worth knowing. Not everyone faces a penalty, not everyone experiences a coverage gap. Whether any of this applies to you depends on your own coverage, your work status, and the choices you make along the way. But each of these 5 points is worth a quick check, so you know exactly where you stand. Number 4 on our list is especially worth your attention if you are still working past 65, since employer coverage changes the entire timeline. And number 5 matters every single year, even if you feel confident about your current plan. Now let's go through all 5 mistakes directly, one at a time, so you know exactly what to check and how to avoid each one. Mistake 1, missing your Part B enrollment window. Don't guess your Part B deadline, a mistake that could cost you an extra 10% on your premium for life. Most people become eligible for Part B around age 65, and enrolling on time matters. If you delay without qualifying for an exception, you may face a late enrollment penalty, generally an extra 10% added to your premium for each full 12-month period you could have had Part B but didn't. If you are still working and have active coverage through an employer, different rules may apply to you. The key step is simple. Don't assume. Check your specific enrollment window with Medicare or Social Security directly to secure your coverage. Mistake 2, skipping Part D because you don't take medication today. No medications today? You still must check Part D. Part D is not only about your current prescriptions, it is about protecting yourself from medications you may need later. If you go 63 days or more without Part D or other creditable drug coverage, a late enrollment penalty may apply, added to your monthly premium going forward. Feeling healthy today does not, by itself, guarantee a safe long-term strategy. Even if you take no medication now, it is worth checking whether you have creditable coverage in place. Mistake 3, not understanding how employer coverage works after 65. Working past 65? Ask first. If you or your spouse have active coverage through an employer, your Medicare timing may look different from someone who is fully retired. Active employer coverage is not the same as retiree coverage, COBRA, or marketplace coverage. Depending on your situation, you may qualify for a special enrollment period once that employer coverage ends. Before assuming you're covered, or assuming you must sign up right away, talk to your employer's benefits administrator. This single conversation can prevent significant financial uncertainty later. Mistake 4, choosing Medicare Advantage based on a low premium alone. Low premium isn't the whole story. Medicare Advantage is not a bad choice. For many seniors, it works well, but choosing a plan only because of a lower monthly premium can leave important details unchecked. Is your doctor in the network? Is your hospital included? Does the plan require prior authorization for certain services? What is the out-of-pocket maximum? Original Medicare and Medicare Advantage each work differently, and neither one is automatically the better choice for everyone. The right plan depends on your own doctors, your own health needs, and your own budget. Mistake 5, never reviewing your plan every year. Review your plan every year. Here is something many seniors don't realize. Plans can change year to year. Premiums, deductibles, co-pays, drug lists, and provider networks included. Staying in the same plan may feel safe, but it is not automatically the best option going forward. During the annual enrollment period, it is worth comparing your current plan against other options, either through Medicare.gov or with a trusted licensed professional. Notice something about all 5 of these. None of these require a complicated decision today. Each one simply requires a quick check, an easy question, or a simple comparison, small steps now that could prevent significant monthly costs and stress down the road. Number 4 is especially worth a second look if you've never compared your Medicare Advantage plan to original Medicare side by side. And number 5 matters every single year, even if you feel confident that your current plan is still the right one. Bringing it all together, the checklist. Check your Part B enrollment window, and don't assume you have more time than you actually do. Check whether you need Part D or already have creditable drug coverage, even if you take no medication today. If you or your spouse are still working past 65, confirm how your employer coverage affects your Medicare timing before making any decision. If you're considering Medicare Advantage, compare it carefully against original Medicare, your doctors, your medications, and your budget, not just the monthly premium, and review your plan every single year during the annual enrollment period, because What worked last year may not be the best option this year. Here's the full picture. Medicare is not designed to trip people up, but it absolutely rewards those who proactively check early and ask questions before assuming. Taking these small steps today ensures your financial and health security tomorrow. Not everyone will face a penalty. Not everyone has a coverage gap waiting for them, but every senior approaching or already on Medicare benefits from knowing these 5 points and checking where they personally stand. This video is for educational purposes only. It is not personal medical, financial, or legal advice. For your own situation, contact Medicare, Social Security, your employer's benefits administrator, or a licensed professional. If you are over 60 and you rely on Medicare, Social Security, or a fixed income, subscribe to James' USA Guide for clear updates that help you avoid costly mistakes and protect your retirement. And share this video with just one person who depends on Medicare so they too can check these 5 crucial points and protect their future.